We've been in the process in terms of implementing reforms. There are a number of reforms effective September 23rd. Some of these have received a lot of media attention. One is insurance companies have to cover children up to 19 with pre-existing conditions. Prevention, that companies will have to provide first dollar coverage for prevention and wellness. Women will have direct access to obstetricians and gynecologists. There will be no lifetime limits on insurance policies. All of these things are important improvements, necessary improvements. The concern that we have in Illinois is we don't have any authority to control rates right now. So the insurance companies are saying, of course, we'll be happy to cover all the children. Of course, we'll be happy to accept there are no lifetime limits. But we're going to charge whatever we feel like charging or whatever we deem appropriate, and there's no regulatory oversight for that or of that determination. So 2 days ago, and if you were to visit our website, you would see our grant application. 2 days ago, we submitted a grant request to the Department of Health and Human Services to receive $1 million to support our review of what are called in the federal law, the Affordable Care Act, unreasonable rate increases. So the Affordable Care Act gives us the authority to review unreasonable rate increases. It doesn't give us the authority necessarily to approve or deny an unreasonable rate increase. But what you are going to start to hear is all of the rate increases are going to become the subject of a lot of public discussion. We're going to receive them, we're going to publicize them, we're going to interact with media, with groups like this and others to help the world understand that right now in our state we are seeing abusive rate increases, explosive rate increases. Companies are milking, talking about mixing metaphors, they are milking the golden goose while it's still breathing. They are getting everything they can out of our state right now. There is, for example, high deductible plans. Some of you might remember George Bush's plan. Let's have so-called consumer-driven health insurance. We'll have health savings accounts, and then we'll have high deductible plans. Insurance companies are increasing the premiums for high deductible plans over 30%. Over 30% for employers whose employees never even hit the deductible level. In family policies are seeing rate increases of 40, 50% or more. Non-high deductible plans for small employers are increasing in premiums 45%. So we are in a difficult situation, but we are going to draw attention to the rate increases. We're going to use the federal money to analyze the rate increases, publicize the rate increases.